right, most definitely he makes the way for Ultimate Health on Joy 99.7 FM. Today we're talking about viral hepatitis. The 28th of July marked as World Hepatitis Day. Many thanks for making that bright choice. I'm in the company of Professor Asante Awuku. He's the head of Department of Medicine at the University of Health and Allied Sciences in Ho. He's also the president of the Ghana Association for the Study of Liver and Digestive Diseases. He's joining me to discuss viral hepatitis, World Hepatitis Day observed, 28th. What do you know about hepatitis? Do you know your status? You know the status of your partner? Have you ever tested? And if you did, what was the outcome? And did you follow the recommendations? That's what we're talking about with Professor Asante Awuku. Prof, you're most welcome and thanks for joining us.
Yeah, thank you very much, Note.
Right. I know you're normally in Ho with UHAS, yeah? And you're also a specialist consultant physician at the Ho Hospital. That still refers to Trafalgar? Oh?
Yes, so that's Trafalgar. So it's now a teaching hospital.
Wow.
Because of the University of Health and Allied Sciences.
Okay, yeah. Years ago, centuries ago, I went there. And then I was domiciled in the Accra Psychiatric Hospital. And it was like, wow, is this in Ghana? I hope it's still in good shape.
Very good shape. Right. There's a lot of improvement now, especially attaining a teaching hospital status.
Okay, yeah. Great. Thanks for joining us. So we've just had World Hepatitis Day. There's a rollout of many activities, including enhancing and increasing awareness. So we're actually indeed very grateful to have you. But for many people, well, they hear these campaigns and they raise awareness and vigilance for a couple of days and then they drop it. So let's put them into the right, should I say, frame of mind. When we talk of hepatitis, my reading suggests, well, inflammation of the liver or a problem with the liver. But bring us up to speed. What is hepatitis?
Yeah, thank you very much. And I've listened to your program for years, and I think you've become better and better.
Wow.
And I think that's quite interesting.
Thank you.
And thank you for having me on your program today.
You can just adjust the mic upwards a bit so you can sit.
Yeah, so essentially when you say hepatitis, like you rightly said, you are talking about inflammation of the liver.
Okay.
And this could be from many reasons.
Right.
So including viral hepatitis, alcohol, drugs, many things. But our campaign is focused on viral hepatitis.
Right.
So what I want everybody to understand is that when you say hepatitis, it is not equal to viral hepatitis.
Okay.
There are many reasons why you could have hepatitis. So but our discussion will be on viral hepatitis
So
today.
many reasons why you can have an inflammation of the liver. And we're looking at one of those possible reasons.
Absolutely.
Viral hepatitis. Now, in this day and age, anytime we hear viral, we're worried, right? So let's bring it down again. Viral hepatitis. What's that?
So we are looking at these viruses that have predilection for the liver. So we call them viral hepatitis. Okay. And we have currently what we all know, commonly classified A, B, C, D, and E. There's a G bit which is not being classified, not in clinical use. Okay. We can talk about as we go along, but these are the key focus. So these viruses have a way that they affect the liver. Their modes of transmission are different as well, which we've been going on campaign, educating people on these mode of, spread, so that they can actually understand it. So as we go along, I will speak to hepatitis A, B, C, D, and E in a very summarized form for people to understand what it really stands for.
Okay, if you just joined us 14 minutes past the hour 2 on Joy 99.7 FM, we're talking about viral hepatitis with Professor Asante Awuku, head of the Department of Medicine of the University of Health and Allied Sciences, right? He's also the president of the Association for the Study of Liver Diseases. So if you have any questions, concerns, WhatsApp is 055 11 11 997, and we're live on Facebook and YouTube. Remember, Ultimate Health is brought to you by Virtual Security Africa. It's a Ghanaian company with 15 years experience in providing integrated electronic security solutions such as as CCTV, access control, intruder alarm, fire alarm, electric fence, and many more. They provide cutting-edge solutions to meet the security needs of their customers with a lifetime after-sales support. You can locate them in Tesano behind the Alive Chapel. Their showroom is at Jowolu, first floor of the Nana Adepa Plaza. In Kumasi, they are at the Santasi roundabout opposite the Goyle fuel station. In Takoradi, they are on the Kintampo Road. You can visit them on www.virtualsecurityafrica.com or call them on 050-331-4068 or 055-851-9839. They bring you ultimate health. We're digging deep to understand the different types of hepatitis, how it is transmitted, how you can get it, and who is at risk. Right? These are very important things you need to know. And based on that knowledge, you can take action and inform yourself. So, Prof, coming back. So, there's A, B, C, D, and E, and a G, which is too technical for us to consume at this moment. Hepatitis A, again, I understand this is more related to fecal matter. Can you tell us about hepatitis A?
Right. So the mode of transmission, as you rightly said, is we call it fecal-orally. In other words, from feces and other to the GIT or the gastrointestinal system through the mouth.
Okay.
And of course, that is how one gets infected.
So the virus for A is found in food or things we take in.
Exactly. So it's transmitted through that pathway. So I can put it together by saying A, E. Are actually transmitted by this same pathway.
Okay.
So these are from feces, food, water sources, and that is how it's transmitted into our mouth, and then into the gastrointestinal system, and then they manifest in the way they do.
Okay.
What is unique about these two is that they usually cause what is called an acute disease. In other words, it would cause effect less than 6 months, and most people will actually recover. These are simple things as if you have malaria. So a lot of people are diagnosed as, say, malaria without the testing. Could actually be because they've been exposed to the hepatitis A. You have a fever, some bodily pains, bit of nausea, sometimes you may vomit, just like a patient who has malaria. And then that would subside, and then one goes through it.
Your body is able to combat and overcome A.
For most people. For most people.
Successfully.
Yeah. Successfully.
All right. Does that render it less significant or dangerous?
It is dangerous, especially when you go on the path we call the fulminant hepatic failure. For those individuals who may be unfortunate that the body is unable to deal with it appropriately, they will go into this severe liver failure, which has quite a high mortality.
Right. Let's not forget that you may encounter these viruses we're talking about, and based on your health status, you may already be battling something else. So we're speaking generally. But if you have other comorbidities or underlying conditions, most of you learned that when we're dealing with COVID, right? It changes the picture. So we're giving you a general outlook or overview before we go into details. Okay, so that's A, right? Short-lived, acute, and typically your body can deal with it.
Absolutely. So we're looking at events less than 6 months. And then your body is fine to go.
All right. There's a test for A.
Yes, there's a test for it. So this is an antibody test, which you take your blood sample, and they'll be able to detect whether what you had was actually hepatitis A. And it's actually available in Ghana as well.
Right. Okay. I know we'll later get to treatments and whatever. Is there a vaccine for A?
Yes, there's a vaccine for A. There's a vaccine for A.
All right. Listeners, note these things down, okay? Then we move to hepatitis B. We keep hearing B, 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 B. My reading suggests that it's about 50 to 100 times more infectious than the HIV virus. What's hepatitis B, Prof?
Absolutely. I think your presentation is apt. What you're saying is that 50 to 100 times more infectious.
More transmissible.
Absolutely.
Right.
Yet when people get such exposures, they are concerned about HIV more than hepatitis B. Like you said, hepatitis B is transmitted through blood product, sexual intercourse. These are the main recognized ways of transmission when it comes to hepatitis B. The interesting thing about hepatitis B is that it does acute disease, and for some people, it will go ahead to become a chronic disease.
Long-term chronic disease.
So we are looking at going beyond 6 months and staying with that individual, if I will put it that way. And what happens, the symptom is just like what I told you in terms of hepatitis A. The fever, bodily pain, nausea, and then you don't feel anything again. And that's it. And then it goes into the chronic phase. And the chronic phase, why we advise people to go and test, is that it will show you no sign or symptom until finally your liver is damaged. And that's why it's really worrying that you need to go and know it. Don't say, I haven't had a yellow eyes before, and therefore it can't be hepatitis infection. But for B, like what we're worried about about is the chronic and the chronic's effect on the liver as well.
Okay.
The liver cirrhosis, liver cancer that are associated with the hepatitis B infection.
Okay. Prof, with a lot of these things, we know also that you can get it by birth. Mother to child transmission or vertical transmission. Does it apply to the two we've talked about so far?
No, so it only applies to B, not A.
Right.
So A, you get it through the fecal-oral route, which we talked about, but B can be transmitted by the vertical route, which we talked about, mother to child, which is an important thing that we really need to focus on. Why is this important? It's because when you get exposed to it in childhood, the probability that you develop a chronic disease is very high compared to when you are exposed to it in adulthood. And I think that is the national strategy where we are vaccinating people. We have the national immunization that vaccinate children to protect them
Are we doing it at birth now?
No, the birth dose vaccine is not yet in. Those who can afford get it, but it's not a national policy yet. Not a policy
measure yet. Okay.
Absolutely.
Right, 20 minutes past the hour of 2 on Joy 99.7 FM. We're learning about viral hepatitis in the company of Professor Asante Awuku of the UHAS University. He's the head of medicine there, but he's a consultant gastroenterologist and specialist physician as well. He'll take your questions, concerns, experiences, and doubts, perhaps. And on WhatsApp, you can share with us 055 11 11 997. We're live on Facebook and YouTube, and shortly I will activate the phone lines. You can ask the questions directly yourself. Okay, so that's B.
That's B.
Okay, and there was no sexual transmission, nothing in body fluids with regard to A.
Yes.
Okay.
Exactly.
Right. So we're moving, and it's getting bigger and badder, as somebody would say. So what about C?
So I'll take it together. B, C, and D are transmitted through the same pathway.
All right.
So blood, body fluid, and sexual intercourse.
Okay.
So C is just like what I told you in terms of hepatitis B when it comes to its transmission. If you also get exposed to hepatitis C, you have a higher probability, even in adulthood, of getting a chronic disease.
Okay.
And it also goes into a silent phase, which is the chronic phase.
Okay.
And cause little damage to the liver until finally you get a very scarred liver, which we call liver cirrhosis.
Okay.
And then if nothing is done about it, liver cirrhosis is always a risk factor for getting hepatocellular carcinoma. And so you may go to this cancer of the liver.
Give us the long one again. Hepato what?
Hepatocellular carcinoma.
All right.
So usually we say HCC.
Right. Sounds like bad news anyway. But so you could progress to cancer.
Absolutely. What is interesting with B is that C is that you definitely have to go through the cirrhotic pathway. Okay. So you go through repeated scarring of the liver, you get liver cirrhosis, and then you can get a liver cancer. Okay. But what is even more confusing when it comes to hepatitis B is that there are those who will not go through this liver cirrhosis phase, but they can directly develop liver cancer because hepatitis B itself, apart from describing it as a viral hepatitis, is also a known oncogene, cancer-causing agent on its own.
Right.
So you may not go through the liver cirrhosis phase, and you can still develop a cancer when it comes to hepatitis B. Okay. I think that's why we hear a lot more about hepatitis B, the conversation all over.
Right. Yeah. Okay, great. So C is similar to B.
Similar to B in terms of its transmission.
So is D.
So is D in terms of its transmission.
Right. So essentially, Prof, are we talking about different causative agents or different viruses? Are they variants of the same thing, or are we just distinguishing them on the basis of transmission?
No, so these are different viruses on their own.
Right.
However, they are transmitted by this common pathway which I've described.
Okay.
Let me just speak a little bit on the D so that we can round up. The D cannot exist if you don't have B. So it's said to be an incomplete virus to make it simple for everybody to understand.
Right.
So anybody who has D means he already has B. Or they were transmitted together from an individual, which we call co-infection. Right. So sometimes you may have a B already, and then you get a D infection, which we call super infection.
Okay.
So D cannot exist on its own. It can only exist in the presence of B.
Okay.
However, C can exist on its own, but there are different viruses that have been described virologically separately.
Okay.
Yeah.
All right. Great stuff. 24 minutes past the hour of 2 on Joy 99.7 FM. We're learning about viral hepatitis. Many of you have responded to similar campaigns over the years. You've gone for tests or screening. You may have gone further for some form of vaccination or treatment or management. Many of you, yes, Stubborn Academy again, you default or you realize, well, I don't really see, I don't feel unwell. and you're lost to the system, okay? And that's the frightening part. Many don't know their status. It's highly transmissible. And when we talk about sexual transmission or transmission through sexual activity of various kinds, then we are in serious business. I'm in good company, in fact, qualified company, not like myself. Me, I'm just a landguard and a foot soldier, right? Professor Awuku, Asante will take your questions and concerns. WhatsApp is 055 11 11 997. Phone line 030-221-6541. Join us. Know your status. Okay, Prof, so we've distinguished the types.
Absolutely.
Okay, so many people don't know. Can you give us a sense with regard to the tail of the tape? Prevalence rates. I've seen and read that it is increasing, okay, in an alarming pattern or characteristic or profile. What is the prevalence? How serious is this for us in Ghana?
Yeah, so this is a very serious situation when it comes to Ghana. I'm going to talk about A and E later on, which are the acute.
Okay.
And then a lot of time when we look at prevalence, because of like being with us for some time, we are looking at more B and C, which are chronic diseases.
Okay.
We have some data for A and E, which I'll share with you later on. But currently in Ghana, if you look at studies that have been done, prevalence varies from 8.6 to 12.3.
Oh, okay.
So I want to make it simple for everyone as we communicate. And then we say 10%.
10%,
which means 1 in 10 of Ghanaians have chronic hepatitis B infection.
Gather, when we mix, right?
Absolutely.
In the average workplace, in the average school, in the average church.
Everywhere. And we have actually shown this because we have done screening in churches, we have done screening in the community, 1 in 10 Ghanaians.
And when we're speaking in these terms, we're logging it down, indexing it on B.
On B. So what I'm talking about is B.
The bad one.
Bad one. 1 in 10. 1 in 10. And what is interesting is that this is vaccine preventable. So we need to really take action so that we don't even get it at all. Because if you can vaccinate to prevent getting it, then why not do that? But 1 in 10 Ghanaians, to simplify the discussion, I think I've given you the exact data, 8.6, 12.3.
Okay.
But in a lot of our tests that we've done around, we've read about 1 in 10.
Folks,
and that makes it easy for communication, for people to understand.
Right. Folks, Prof has put it in simple terms. I've read researches over time. I've done hepatitis education and awareness over time on this program. I've seen 8 to 16, sometimes even above,
20.
Right? In different parts of the country and in different populations. Absolutely. For example, you can check for hepatitis B in pregnant women and so on and so forth. So we're talking serious stuff here. Okay, don't forget, pregnant women are married to men. Okay, so we all need to take this seriously and ask our questions as well. I see some of you typing on WhatsApp. I'll get there in a sec. So, Prof, I talked about mother-to-child transmission, right? Can you just say a word on prevalence when it comes to pregnant women, if you can? Or?
Yeah, so what we've realized that for those who are positive, pregnant mothers, it depends on certain factors. We call E antigen, the level of your the virus in that individual.
Right,
and then it predicts your transmission, but roughly about 20%. So 1 in 5 of pregnant mothers who are positive are likely to transmit to their kids.
Right, Prof, I want to stand or kneel on my chair and ask you, are we routinely by policy as a country, Ghana, testing all pregnant women?
So currently it's by policy. So
we're
all pregnant by policy. So it's only the opt-out approach, unless you say you don't want to be tested. But it's by policy, all pregnant women, yes, it's offered to them.
Okay, which tells you that the 20% Prof is mentioning is not conjecture, right? We have the data because we are now testing all pregnant women. You go into hospital, antenatal, whatever, you'll be tested for hepatitis B.
Hepatitis B. So it's routine hepatitis B. Every pregnant woman in any state institution that goes to the hospital, you are offered this opportunity.
Okay, right.
You're offered. So you can turn it down. It's an individual decision.
Refuse.
Well, I do not have that experience.
Why in heaven's name would you refuse?
Absolutely.
Whoa. Okay. All right. So we can capture it there.
Absolutely.
And 20% is alarming.
Yes.
Of pregnant women.
Women. If nothing is done about it and you go through, the probability of transmitting to your child is roughly about 20%. But what I'm saying, a lot of factors would influence that.
Okay.
Whether you are E antigen positive or you have a very high viral load, it would influence the level of transmission as well.
Right. Prof, confirm this also for me, or disprove it or disagree with it if I'm wrong. My reading also suggests that the younger you are when you are exposed to the virus, the higher the chance that you develop chronic hepatitis. I think you touched on it earlier. Is that so? If you get it younger, if you're exposed to it younger, then there's a higher likelihood that it may transition to chronic.
Absolutely. So you're very correct on that. We are looking at 3 to 5 years, about 30%. And if you're about less than 5 years, almost about 80%. And those who are adult, the probability of getting a chronic disease, about 5 to 10%.
Okay.
So it reduces as you grow.
Right.
And that's why I'm saying the emphasis, childhood vaccination, so that we can prevent this transmission.
Okay.
Yeah.
Great stuff. We're learning. So, Prof, you've mentioned how there's a test for all of these.
Yes, there is.
We can
and it's
screen
available here.
and test. Okay. I want to do this before I do signs and symptoms, though you mentioned jaundiced eyes or other things. Yeah. But who should be testing? Who is at risk of viral hepatitis?
So if you look at a lot of the recommendation from WHO and other international bodies, those who are transmitted through the oral and the fecal-oral route, usually it's not mandatory to get tested. But for B and C,
right,
they talk about the fact that for B, any community where they have a prevalence more than 2%,
right,
everybody should be tested. I'm telling you, we have about 10%. So for us, it's a must.
Everybody must test.
Yes, if you have prevalence of more than 2%.
In your country,
then
right,
everybody must be tested. This is the WHO recommendation.
Okay.
And I'm saying that here, we are looking at 10%. So what does it mean? It means everybody must be tested. In fact, we need it more because we are talking about prevalence of 10%,
right,
and not 2%.
Okay. Now, with regard to that, I read something which alarmed me a bit because I was trying to tease out of the data whether we have a national hepatitis elimination program. Okay, we are still figuring our way out, and other countries have it. Indeed, I saw that in Uganda and Rwanda, they are testing, I think, children or babies at birth free as a national policy. We are still figuring our way out with regard to that. So it means that those who are testing are literally making a discretionary or voluntary decision.
Yeah, so currently, I mean, those who are tested is actually voluntary. There's no policy that everybody should be tested. But at risk group like pregnant women, patients going on dialysis and all that, you need to test because you have a risk of transmitting to others.
Right.
So that's what it is. Currently, the National Virus Hepatitis Control Program has some initiative towards eradication, but we do not have any policy on eradication yet.
Is it possible?
Yeah, it's possible. In fact, we are working around that. The program is actually putting in measures to do that.
Are there countries that have, in quotes, eradicated or eliminated?
Yes, so the best example is actually Egypt.
Wow.
They had the highest prevalence of hepatitis C worldwide, not just in Africa. And they saw the need to get rid of this, and they've been able to do that. So we're learning from them. Recently, we had a very good interaction with them where we actually have free hepatitis C treatment in Ghana now.
Okay.
So all you need to do is to test, get to know that you actually have chronic hepatitis C, and you can get a medication for free.
Specific to C?
Specific hepatitis C.
Okay.
C,
what about
because
B?
You can get a cure. B, currently, the medication is not for free. You need to pay it yourself. What we also have to say is that there is no cure for B currently. We can only manage it.
Okay. So let's go back to testing. Is testing free?
So testing is not free.
There's no free testing
There's
for
no
hepatitis.
free testing. You have to pay for it.
Okay. So when we refer to the pregnant women, it is offered but not free. Is that
offered but not free, but when you're on the insurance, national health insurance, it's part of the package.
All right.
So you get tested for the national health. But if you're an individual who is not on the insurance, you would have to pay for it.
All righty. 33 minutes after 2, my time is far spent, but my lines are activated. 03-0221-6541. Call and speak to a whole professor. Yes. At your disposal at least till 3 o'clock, right? His pay is above our grade, but we've got him for about an hour, right? Many thanks to Dr. Awuku. She's been with us. She's a hematologist, right?
Yes.
Yeah, she's loaned her husband to us this Sunday. He's typically in Ho, but we've whisked him away for your benefit. 030-221-6541. This one says, "Hi, Noted. Well, thanks for your educative programs. Please, I've been married for 15 years. My wife had hepatitis whilst at university about 20 years ago, so all our kids are given injection as soon as they are born to prevent them from getting it. Please, I once did a test and I was told the results show that I've been close to someone who has had it. Please, can my immune system keep me protected, or do I need to go for an injection too? Also, I love my weekend beer and whiskey. Can it increase my chances of getting hepatitis? So you want to confess that you are burdening your liver, in a sense. Please, can I just walk to any hospital to request for the injection? He's talking about injection, right? So he's talking about his wife, and very often we get discordant couples where one is positive, the other is negative. Indeed, I was going to forward a question like that to you. Somebody says, well, if it is sexually transmitted, I have it, my partner doesn't have it. How so? And it raises issues because maybe my partner might think I went and picked it from somewhere, right? Sexually, right? Can we answer this gentleman's question?
I think this is the maybe the best question, or maybe more interesting questions are going to come. And this is a scenario I actually had a deliberate, should I say, presentation for.
Okay.
Because you usually have these serodiscordant couple who have come in. And like I read this, I'm going to start from the beginning. The common way by which one can become chronic when it comes to hepatitis B is during childhood.
Okay.
And we said one of the commonest means by which people get this infection is perinatal after their delivery and whilst pregnant and during delivery. So vertically. Right. So a lot of people actually get it through this pathway and they have no idea. Because we're going to talk a history about when testing even started in Ghana.
You could have gotten it from your mother.
Absolutely.
And you don't know.
Yes.
Right.
I have seen families who have been wiped out by liver cancer.
And they
because they had no idea.
And
but their mama was positive and their mother is alive. So people present differently. So this is a very interesting one. But usually when you get married, it's not a problem at all. And the other partner is negative, one is positive.
Right.
What you need to do, especially they have been together for a long time.
Okay.
You need to do what is called the hepatitis B profile.
Right.
We want to see whether you have been vaccinated sexually, if I want to put it that way. Because you've been exposed to your partner who has the antigens.
Slow down. Sexual vaccination, which means that you've been exposed.
Absolutely.
Sexually, your body has dealt with it and has built antibodies.
Exactly.
So you are protected.
You are protected. But what you need to actually demonstrate that.
You need to check
the titers. Yeah, so you can actually check the hepatitis B antibody titer.
Okay.
And most of these that I've seen, they have higher levels of titer that they don't need any vaccination.
Right.
So if you have been with your partner for that long, you've had all your kids, you realize the one is positive, one is negative, it's not a problem at all. The one who is positive, we can handle it. The one who is negative, do the profile, and then we'll let you do the antibody test.
Okay.
If you have enough levels, you don't need any vaccination. And gentlemen, maybe you can enjoy your officer life.
Right. So in this instance, let me say in quotes, we don't need to bring in a special prosecutor.
Not at all.
Right. Clinically, we can explain.
Absolutely.
Okay, you have some level of immunity or protection, right? Because you've been exposed before. You didn't get ill. Your system has dealt with it. So how come, Prof, explain to my listeners that mine is undetectable or I get a negative outcome? Because he's saying that his test, probably had done the further test, said he has been at risk. Right? Can you explain that?
Yeah. So what it means is that he actually did what is called a profile.
Okay.
So the profile will tell you about what is called hepatitis B core antibody.
Right.
It's the IgG type.
Okay.
Anybody who has been exposed in the past, your body has cleared it, your core IgG is positive.
Okay.
But the surface antigen, which tells you that you have a chronic infection, is negative.
Okay.
So this is what this gentleman is talking about.
Okay.
He's done the hepatitis B profile, and specifically the core IgG is positive.
Okay.
All other things were negative, and even sometimes the E antibody is positive, E antigen is negative. All it means you have been exposed to the original virus, you have cleared it, and it's left something behind to show that this virus was here in the past. But now you are protected.
There's nothing to fight about with your partner.
Not at all.
Right.
Not at all.
Unless you already had issues.
All right.
Right. This is why we bring them in. Listen every Sunday, 2:05 on Ultimate Health Joy 99.7 FM. We're talking with Professor Asante Awuku of the UHAS University about viral hepatitis. Call in 030-221-6541. If you have any direct questions, you can WhatsApp us on WhatsApp 055-1111-997. Ultimate Health on Joy 99.7 FM with me,
Joy 99.7
Naughty by nature. Okay. Are you at risk if your employee has hepatitis B? So workplace exposure. I mean, we work with people. I've read that you can't get it from eating with somebody. You can't get it through kissing and a few other things. This person has moved it to the workplace.
Yeah, so what I've realized is that most people get confused. Sometimes somebody's been employed and then they do all that. And I hear people, when their test is positive, they refuse them opportunity to work. And that is unacceptable because it cannot be transmitted by activities at the workplace.
Okay.
You've rightly said, not by touching, not by eating together. All these things cannot transmit the virus. So
not through sweat?
Not through sweat.
Okay.
Not through sweat.
Right.
I mean, at the workplace, not through sweat because skin is intact. There's no exposures.
All right.
And so you cannot get it. So sometimes I get surprised when people test positive and they deny them work opportunities.
Pre-employment screening, and where they turn out positive for hepatitis, you're saying some employers wrongfully, ignorantly, are using this as a basis.
Yes. Yes.
They may or may not express it directly, but it could be used. And it's wrong.
Yes, very wrong. I think we should not promote that at all.
Okay.
If you're fortunate, the person gives you a feedback. It's like the doctor wrote that they should not take you at the job place, which is not true.
Okay.
We actually talk about recommendations, tell you that you can be managed. In fact, hepatitis B, not everyone needs treatment. We need to follow you up.
Some people, they tell you, rest, eat well,
and they will follow you up in the clinic.
Then
you have regular schedule that we give to that individual.
The important gateway to all this advice and intervention is that you have tested and you know your status.
Absolutely.
And then you know where to go and you know which further tests to do.
Absolutely.
All right. Yeah. Great. My producer tells me I have a caller on the line. Hello, good afternoon.
Hello, good afternoon, Mr.
Right. Who am I speaking to?
Yes, speak to Senam from Lashibi.
Senam from Lashibi. Senam, have you tested for hepatitis before?
Yes.
You have? Oh, that's great.
Yes.
Okay. What caused you? What pushed you? What compelled you to test?
Oh, actually, my mom is a health worker, so she actually asked me to do it 2004 then.
Okay.
I did and then took the vaccination.
Okay, great stuff. You have a question? Yeah, go ahead.
And 2011, I took a booster. So it's about 12 years now. I want to know if I have to go back and take another vaccine again.
Okay, all right. Okay, unofficially, I'll declare you hepatitis macho. But you responded to your mom, got the test in 2014. You further, after that, had boosters and so on and so forth, right? Prof, what do you say to her?
Yeah, so another layer I want to bring in is that if you get vaccination, after completing the vaccination, you need to test and see whether the vaccine worked.
Okay.
What I want to say is that vaccination is not equal to being immunized. In other words, getting the vaccination is that you receive the vaccine. There's a question of did it work or not. So once you complete the vaccination, there's a protocol where you go and check for the surface antibody level. And you need to get it to be more than 10 international units to say that you are protected. Right. So for this individual, probably she didn't need to go for a booster. All she needed to do was to test the antibody level. And if it was detectable or more than 10, then she can actually be confident that she's protected and doesn't need to be a booster.
Okay, Prof, I'm loving this because years ago I had to get a resource person in the same vein as you are now to distinguish between vaccination and immunization, right? The vaccination has an objective. If it is achieved, then you are immune or immunized, all right? So we have these yellow cards. They are vaccination cards.
Absolutely.
Okay. But are you suggesting, therefore, that that could not, should I say, translate to automatic immunization for some of these things?
Yes, that's what it is.
Oh, wow.
There are some of these vaccines that they are very clear objective. For instance, when it comes to hepatitis B, you can easily measure the antibody level.
Okay.
And it's been shown that depending on antibody level, you may have the protection. So once you get a vaccine, please go ahead and test and see whether you're able to for hepatitis B. In fact, 1 in 10 after getting the vaccine may not have any response at all. So you need to know whether you are one of those groups.
All right. Okay. Great stuff. I have another call on the line. Hello. Good afternoon.
Good afternoon, sir. How are you?
I'm fine, thanks. Who am I speaking to?
I'm called Kwesi.
Kwesi, where are you calling from?
I'm calling from Commander.
Commander, share with us something sweet, Commander.
No.
Go ahead.
Somewhere 1990, I had a blood donation. And I was told I'm a carrier. I tried to do donation. They say it's not possible. I want to know, should I go for immunization?
Okay. Right. So the year again you went for the blood donation?
1990.
1990.
Yes,
right?
Please.
And you were told you were a carrier of hepatitis?
Yes.
Okay.
Please.
Was that all?
I have the certificate there.
Right, but did you have any other follow-up with regard to the hepatitis itself?
No.
You didn't go for further investigation?
No.
Okay. Right, let me pass this to the professor. Right. So he went routine blood donation, okay? And I know this is one of the indicators they look out for, and you are excluded from donating blood. Indeed, in other research I did, even when it comes to organ donation, there are a few things they need to check, right? He wants to know, he's been barred or excluded from voluntary blood donation. His blood cannot be used, and he wants to know, should he go for any further protection?
So your
having been declared a carrier.
Your listeners are really bringing in the
great
key questions around this.
This is the place to be.
Absolutely. So if you look at this person's scenario that was created in 1990, what we're trying to say is that it's a carrier, and we do not do this classification in this current dispensation, because who is a carrier? All it means is that he has chronic hepatitis B infection, and he needs to be followed. So
a carrier, you're saying that the description, the label, the categorization given to him is
inappropriate.
Right.
Inappropriate in terms of current categorization of patients who have chronic hepatitis B. In the 1990s, I understand.
Okay.
Once you test positive, you say, well, you're a carrier. But there's a lot of information, there's a lot of knowledge now. Okay. And that shows clearly that this individual most likely has chronic hepatitis B infection. Okay. And so he definitely needs to come back for new testing, to do profile, viral load, check the liver test. I'm happy he's calling in now. He should not wait at all, so that we can recategorize him. And if there's a need for an intervention, we'll do that for him. Vaccine, I don't think is the way for him, because most likely he has an infection and he needs an intervention.
Okay, great stuff. And thanks for sharing by calling in and by your WhatsApp messages as well. WhatsApp is 055 11 11 997. Phone line 030 221 6541. Station, of course, Ultimate Health. Joy 99.7 FM. Yeah, I made my program a station, eh? All right. So this one says, good afternoon. I'm Michael from Tema. My father died from the disease in 2006. I recently became sick and went for the test. It came out negative. Should I still worry, especially when I have had jaundice before as a child in the 80s? Let me read a couple so we can take answers for them. Right. Can a hepatitis B positive client travel outside the country? So this is referring to travel restrictions. And Abeku, you let me control from here. Good afternoon, Mr. Host and your facilitator. I just loved health education, but the Volta region also needs education. This is Abochi Philip from Keta. We are learning that HBV can be treated with herbal medicine, as some herbal clinics in the country are claiming, ? This is from Dagati in DC, which I believe to be Dansoman. So herbalists or herbal practitioners are making claims. Prof will note that for a response. This one says, this is from Cynthia in Botre or Ashale Botre. Please, can you find out from the doctor if there's a policy to test and vaccinate health workers, and is it free? Right? There's policies for those who are likely to be exposed as a reason of on account of their occupation. This one says, Norte, can you walk into a health provider and request for all types of hepatitis tests at a go? Or do you request for a particular type, like the sexually transmittable type? Okay, so can you request and select the type you want to be tested for, or do they do a battery of tests to check your status for all of them? Abeku, please let me control from here. It makes me easier for me to read. Please, not to do a super submission on Thursday. Great job doing. Douglas from DC. Okay, right. Okay, right. So let's try and take this step by step.
Yeah.
Okay, so we got the one asking about travel.
Yeah.
Okay, let's deal with travel and hepatitis.
Yeah, so that there's no policy on that when one is hepatitis B, just like any other condition.
Okay.
So if you have a positive hepatitis B, there's no country bars you from entering that place. So that is very clear. No policy on that.
Okay, right. Can you find out policy for health workers, and there are other categories of exposed or potentially vulnerable categories of workers?
What I would say is that there's a document and not a policy. Right. A policy is that if a health worker is employed, he goes through screening. If he's negative, he's vaccinated for free by the employers and everything. But that is not what exists now. So it's individuals taking their own decision to go and test, and if they are negative, paying for the vaccination. But I think this has to change.
All right.
Going for a special for health workers because we are at risk. And so that has to change.
Okay. Great stuff.
I heard about medicine. Okay, you were going to one person talk about education in the Volta region.
Right.
This year, in fact, the Ghana Association for the Study of Liver Disease, we actually dedicated our campaign in Ho.
I saw pictures of some of you out there.
Exactly.
Yeah.
We went to a lot of places, including Fuega Senior High School, where we did screening for them. So this year, it looks like Volta region actually enjoyed a lot of what we did in terms of the viral hepatitis campaign.
Okay. Right. Great stuff. Herbalist or herbal treatment. I'm using my words carefully, of hepatitis or hepatitis B specifically.
Currently, there's no approved treatment when it comes to viral hepatitis B. The FDA and other agencies are asking those who make the claim that present your data, let's go through it.
Okay.
And then if it actually proves that you're able to do that, we'll give you that. But so far, we do not have anyone approved for that.
Okay.
Yeah.
All right. So anybody doing that is what? Making their own unverified clinical claims.
Absolutely. I think it's unacceptable.
Okay.
Because some of the herbal medication may have further damage on the liver.
Right.
And so it makes it worse. They need to really reevaluate. I know definitely there are herbs that has active effect on these viruses, but they need to be properly put together, go through the appropriate processes, and then get approval so that we can also support it.
Okay. Please note you are getting this response from the president. Not only is he a specialist consultant gastroenterologist, president for the Ghana Association for the Study of these liver diseases and so on and so forth. So when he says there's no verified, approved herbal cure, is not a jab at herbalists or anything. He's talking clear science, and herbal medicine also follows science.
Absolutely.
All right? Okay, great stuff. Can you walk into a health provider and request for all the types of hepatitis tests at a go? Or do you have to request or select what you want to be?
You're welcome to do that. You walk into any facility and tell them that you've had a lot of education, a lot of information, and you want to test if you have any of these viral hepatitis.
Okay.
And whichever doctor is there would welcome you, give the right education, and give you appropriate prescription to get it tested.
Okay, great stuff. Let me just remind you, Ultimate Health, this and every Sunday is brought to you by Virtual Security Africa, a Ghanaian company with 15 years plus experience in providing integrated electronic security solutions such as CCTV, access control, intruder alarm, fire alarm, electric fences, and many more. They provide cutting-edge solutions to meet the security needs of customers with a guarantee of lifetime after-sales support. You can locate them in Tessano behind their Live Chapel. Their showroom is at Jolu, first floor, Nana Adepa Plaza. In Kumasi, they are at Santasi Roundabout, opposite the Goyle Fuel Station, and in Takrade on the Kintampo Road. You can visit them at their website, www.virtualsecurityafrica.com, or call them on 050-331-4068 or 055-851-9839. VSA, Virtual Security Africa, they bring you ultimate health on Joy 99.7 FM this and every Sunday. This is somebody's asking for the best treatment for syphilis. Well, we're discussing something else, and I'll take note of your number and get more details for you so that we can direct you, okay, so that we don't deviate. All right. If you have any questions, concerns, still time to catch a couple of calls. 030-221-6541. My guest in the studio is Professor Asante Awuku. He's a consultant gastroenterologist, and he's the head of medicine at UHAS, University of Health and Allied Sciences in Ho, and he's also a consultant specialist physician and gastroenterologist with the Ho Hospital. Does vaccination against hepatitis B work against A, C, and the rest? Okay, we're delving or switching to the interventions. Yeah. But before you answer this, Prof, after a test outcome, right, the outcomes are either you are positive or you are negative. Is there any other outcome possible?
So the other outcome is that you are negative and that you have protection.
Okay.
So three outcomes are positive, negative. Or you are negative, but you are protected.
You are protected. Can you explain that?
Yes. In other words, for instance, hepatitis B is the best example.
Okay.
So you are negative, but you see that core IgG, which you talked about, the first presenter, which show that you've had a past infection.
All right.
But then we look at your surface antibody, and it's high up there. It means you also have protection.
Okay. So when we say somebody is in this category, right, it means we have clinical evidence of exposure.
Absolutely.
And an immune system response.
Absolutely.
Okay.
So the exposure marker is the core IgG.
Right.
And the immune response is the surface antibody level.
Is this well communicated to the patient or the client being tested?
So we do that. So I am actually advocating that if we want to
what should you be told specifically? How is it communicated?
Good. So for you to get that communication, you should have done the hepatitis B profile.
Okay.
So we will tell you that you are negative.
Okay.
However,
you need to do further tests.
No, the profile will describe all of it.
Go ahead.
It will say you are negative.
All right.
However, because this core IgG is positive, it doesn't mean you have an infection, but you have been exposed to it in the past.
Okay.
And again, we have seen your surface antibody is positive, which means that when you're exposed to, you're able to clear it. That is why your surface antigen is negative, and that you have surface antibody positive. So you are protected.
So your body has its own polling station results.
Absolutely.
Which can be tracked clinically.
Yes.
Okay. So that person who doesn't have a current infection, right? Negative with all these details, with good protection. Can they transmit?
So they don't have an infection. So they don't have an infection. Yes. So if you do the viral load, it will be zero.
Okay.
There will be nothing in there. So they don't have any infection.
So what is the advice for them? What do they do?
So for those individuals, usually what I ask is that do the surface antibody level.
Okay.
Anything above 10, you are protected. You don't have to do anything. You don't need any vaccine.
Do the surface
antibody level.
Antibody, not
antibody level.
Right.
And once it shows anything more than 10, you are protected. There's a lot of evidence that even when it's positive, it's just enough. But I don't want us to go there.
Okay.
I think 10 is a good point.
Right.
Yeah.
Good. Well explained. Right. And I'm loving the way you're explaining this. So is it for the patient or the client to request the further investigations, or will it be routinely requested based on their ability to pay for whatever test it is? How does it go? You've got this situation. This is your categorization, negative with this, that. Yeah. Will the clinic, the lab then go further to request, or is that for a physician or a doctor to do?
It's actually doctor driven.
Okay.
So it depends on the expertise of the individual you're seeing. And this is why you would have to see the trained gastroenterologist. Apart from that, there are others who have also dedicated themselves. We do a lot of training.
All right.
Who have been empowered by that means.
Okay.
If not, once it's negative, that individual or that health professional may just say you are negative.
All right.
But for us as specialists, it goes beyond just being a negative.
Okay.
There are some unanswered questions. Have I been exposed before?
Okay.
Am I protected? Do I need to get a vaccine?
All right.
And that is why you need to get a full profile so that individual can advise you appropriately.
Prof, there's a lot of testing, there's a lot of empowerment, education, awareness, which encourages us to test at various facilities. Yeah. Okay. Many people are going to quite happily walk away with a negative. You're suggesting to us that there are further levels of analysis of your profile. Okay, how do we reconcile this with this? Go out there, go and test. Let's say Joy FM does testing. We've done that before, actually. Steve and Co. Thumbs up to you. We've done that in-house here. But so when you get your result at a workplace or a church program, and it says negative, and there's nothing further communicated, is that okay?
I don't think that is the best. What we're advocating is that for screening, we want a lot of people to get that exposure.
Okay.
And we think saying negative for a start is good. But you have to say you are negative.
Okay.
But the issue is that the prevalence in the country is very high. You may be a mother or you may be a woman, and that there's a risk that if you get pregnant, you can even transmit to your child.
Okay.
So why don't you make sure that you don't even have the infection at all? So after you've tested negative, go further.
Okay.
To see, am I protected? Do I have the necessary antibody level?
Okay.
Have I been exposed in the past? Which is also a good idea.
Okay.
So once you've been exposed in the past, then we will see whether you were able to clear it, and then whether you build antibodies to protect yourself. So I think we should go further.
All right.
But the first test of a negative reassuring people is good.
All right.
But let's move on to the next step.
Okay, so just quickly, we're running out of time, and I know we wanted to look at vaccines, what they do, how often you need to take them, and so on. We'll make time because I know your squad, you've got a whole SWAT team out there. I got only you today. But so any advice to, churches, groups who are hearing this and they organize, they get groups to come in to do the testing and all that? Should there be a difference or a tweaking of the model? Because very often you have the names, contact numbers, there's opportunity and data to facilitate follow-up to do these things? Should they just be happy that we did screening and we're happy as part of Rotary this or whole week celebration that or church retreat this? Should there be a difference or a tweaking?
Yeah, I think they just need to move it to the next level. What Gaslit has done over the years is that we develop a small, like a hospital card sort of.
Okay.
So once you come in and you are negative, you write that you are negative.
Okay.
And then we educate you that you need to go through other process to see whether you are protected, to get vaccinated, and they will write in a card for you. So you can present that card in any hospital. Okay. Those who are positive also will write a little note in that.
Right.
They can present it to a hospital. So I think you should not just say negative, go home.
All right.
Let them still go on further.
We should
to
know.
Look at
Okay,
it. Yeah.
great stuff. So the vaccines, do they cover the whole show, or are they specific to the actual viral agent determined?
So they are specific. So currently we have a vaccine for hepatitis B,
right,
A, and E.
Okay.
So we do not have any vaccine for hepatitis C. And so you cannot say you are going to vaccinate to prevent. But B, we have it available here. A and E is also there for those who are going to high risk area. Like I told you, it's for acute diseases.
Okay.
So for instance, you're going to embark in something that you think your exposure to feces and other things are high.
Right.
You can get this vaccination as you do that travel.